Welcome back, everyone. We are Einstein's Eyes, our YouTube channel. I'm Carl Rosen. I'm in Anchorage, Alaska. I'm a fellowship-trained oculoplastic specialist and ophthalmologist. My partner, Jon, is an ophthalmologist and cornea specialist in New Jersey. We trained at Albert Einstein College of Medicine, Montefiore Medical Center, and that's why we call ourselves Einstein's Eyes. If you've seen our other videos, you know that we pick selected topics. We try to make it conversational and easy to understand. Today, we're going to talk about a scratched cornea. This is very common, happens all the time, uncomfortable. And I'm going to ask Jon to explain how he thinks about a corneal abrasion, how he assesses it, and how he manages it. Jon, it's all yours.
So corneal abrasion is one of the most common, or scratch cornea is one of the most common conditions any general eye doctor will see. The cornea is the front layer of the eye. So it's right underneath a person's eyelid. And that part of the eye protects the eye, so it's actually prone to injuries. If you look at this image, you can see fluorescein dye. So if you've been to an eye doctor, you see they sometimes put a special dye in the person's eye that illuminates it. And the normal cornea will not light up. But you can see here the yellowish area, not so much on the lid, that's all artifact. But in the cornea, which is the center part where you see the pupil, you see that irregularly shaped yellow area. That's the actual abrasion or scratch. So that means the outer layer of the cornea, which is the epithelium, is not intact. So that's why this person is going to be very uncomfortable. Every time they blink, they're going to feel like something's in their eye. The cornea is exquisitely sensitive. There's so many nerve fibers in that one little area. It's one of the most sensitive parts of the whole body. So a little scratch like that causes horrific pain for most of my patients. So what do we do about this? So a person will come in, they'll say, suddenly, something got in my eye, or I was rubbing my eye and this happened, or my kid poked their finger in my eye, or I was moving and something hit me in the eye. And all of a sudden afterwards, they feel fine, their vision's fine. However, they feel significant pain, especially when they close their eye or they blink. They come in, we diagnose a corneal abrasion. That's pretty straightforward. The good news about a corneal abrasion or a scratch cornea, it's going to heal on its own, just like a scratch in your skin. So that outer layer, the epithelium, is going to heal usually within a day, two at the most with a scratch cornea like this. So a lot of it's just reassurance, telling the patient, listen, I know you're uncomfortable. You got to grin and bear it. It's going to heal, just like any scratch in your body would heal. And the good news is it's going to heal without any sequelae. The person's going to end up with normal vision, no permanent damage from it. It just takes a little bit of time to heal. So what we need to do is make sure they go on an antibiotic eye drop. And the reason we do that is when the epithelium is scratched or not intact, there's a risk that an organism or a bacteria or even a virus can get into the cornea, because normally the epithelium protects your eye. If the epithelium's not there, that protection's gone, kind of like an outer layer or a fort. And once it's not intact, those little bugs can get in there and cause an infection. So the important reason to see an eye doctor is to diagnose this and get on topical antibiotics, meaning antibiotic eye drops or ointments. And as long as you're on the antibiotic, that prevents an infection. The antibiotic does nothing to get it to heal. It doesn't make the pain go away. It doesn't do anything other than prevent infection. So all we're really doing is reassuring and basically making sure until it heals, the person doesn't get an infection. But it heals quickly. I mean, Carl, I know with you, unless a person has a really large abrasion, most of these will heal within a day, two at the most. The other thing I like to do is give the person artificial tears or lubricating gels, because that does soothe the eye a little bit. And it also does help it heal a little bit quicker. Kind of like you would do if you had a scratch in your skin, you might put some ointment or gel on that to lubricate.
Jon, what do you think about adding a bandaged contact lens to a corneal abrasion to prevent patients from feeling pain when they blink?
I think it's a great option. Yeah. I think for the average person, a small abrasion, it's going to heal within a day. I really generally don't do it, but I think it can be offered and it's a good alternative. I'll give you a great story. So many years ago, I saw a patient. It was February 13th, about 15 years ago. So why is that such an important?
Can't be more precise than that, Jon.
Right. Well, the woman owned a florist shop. So this is the busiest, most important day of the year for her. She scratched her eye at work. basically taken out some roses or something like that. She came in, she couldn't even open up her eye. She couldn't function. So I'm glad you brought that up. So in this lady, I felt, yeah, we want to prevent an infection, give her antibiotics. Yeah, give her some lubricant. But she had to go to work. She had to be at work that day. So in that context, yeah, I put a contact lens in her eye, which is very simple and safe. Put her on antibiotic eye drops. And the contact lens was incredibly helpful in minimizing her discomfort. She was able to function, get through her day. I mean, she still thanks me to this day because she would have lost a day of business. She couldn't function.
Right.
It's a good thought. The other question is, do we patch these? Remember in the old days at Einstein, we were trained corneal abrasion, you need to patch. So you patch theoretically for two reasons. One, for pain relief, and also to help it heal. The truth is the studies have not shown patching to be helpful in either. The pain is no better and the healing is marginally better. So to patch someone and make them have to come back to the office and take the patch off. And generally speaking, I put them on antibiotics. I tell them if they feel okay, they heal.
Right. I don't patch, but I do like the contact lenses, John. That saves me a lot of grief. I usually have them come back in a day or two and have one of the technicians remove the contact, and folks are universally happy with that, with an antibiotic drop. John, once again, thank you. Folks, we're going to wind it down here and say like and subscribe, and please check us out on the next video.